Sir, good afternoon.
Good afternoon, Dr. Kirti, and good afternoon, everyone.
Good afternoon, everyone. And I once again welcome you all to this Facebook live session from Dr. Makkar's Diabetes and Obesity Center. The topic of today's discussion is obesity in elderlies, some unusual topic to talk about. Usually, what we see is we are talking about obesity in young generation, but this is the area which is untouched. So at times we come across patients, elders who ask us, "Ki, doctor, at this age, do I need to worry about weight?" So this answer we need to take care of because it's a very sensitive topic. And actually, we are not chasing aesthetic part. We are not chasing thinness. We are talking about their strength, their mobility, and their independence. So, sir, my first question to you is, which is very important to take care of. When we are talking about the elderly group, what age group are we exactly talking of? Sir Vinod sir is here.
Good afternoon, sir. Welcome
Good,
to the Facebook Live.
good afternoon. My internet is creating little problem, so I'm outside on my telephone.
Never mind, sir. You are connected and we can hear you, we can see you.
Correct. Thank you.
Thank you for joining, sir.
Thank you.
So I'll introduce Sir. Dr. Professor Vinod Kumar, sir, is one of the most eminent speakers, doctors in the medical fraternity. He is ex-professor AIMS, HOD, PGI, Chandigarh. And he has numerous publications under his name. He is the author of many books and chapters. Welcome, sir, to the show.
Thank you for having me. Thank you once again.
So, Makkar sir, now it's your duty next.
So, sir, it is indeed an honor to have you on this, Facebook Live. And I had briefed you. We do it every Thursday, 3 p.m. For public education, largely patient and public awareness. And we are in an era where obesity has become a pandemic, and it is affecting all the populations across globe. And India is also not left behind, despite we think, we are a developing country. And with increasing prevalence of obesity, we are seeing now people in the higher age groups also getting affected by obesity, or they are obese during their middle age and they move into the elderly age also with obesity, and this becomes a challenge. So, first thing I would like to ask you, sir, is are you really seeing obesity as a challenge in the higher age group? And when we talk of, say, obesity in elderly, how we define elderly first? When we say that this person is, in the elderly age group and we should take care of obesity as, somebody in elderly.
Well, I think you are absolutely right that obesity is challenge across all segments of population, and it is true of elderly also. But I would hasten to add that obesity in elderly is not always apparent from external appearance. It may be lying within the body without changing the dimensions and outside shape of the person. This is how it differs from the obesity in young people. What is actually happening in the elderly group that over the course of their lifetime, the fat content of the body keeps on increasing at the expense of non-fat mass of the body. By non-fat mass of the body, I mean the muscles and to some extent bone and other places. So what is happening that the fat is there in the body, but it may not be apparent from outside because it has moved from under the skin to inside the body in the viscera, muscles, and other places. And what we call that obesity as the central obesity. So, central obesity is something which may not be visible from outside, but this accumulation of fat in the center inside the body is even more detrimental what you see from outside. And this is the hallmark of obesity, or you can call the fat collection the elderly, and this is how it differs from the young people. So I would not hesitate to call this obesity as internal obesity when elderly people are concerned, as opposed to the externally apparent obesity that you see in young people.
I think this is very interesting aspect, which people don't, we largely don't consider. Uh, Sir, there is another thing that we see commonly now in the current era, and you are one of the, you know, I would say the exemplary personality in maintaining youth in the elderly group. So when we start calling somebody elder, the WHO defined young, old, middle old, and old, about 65, 65 to 75, and 75 to 85. So is it related to the number of age, or is it related to the functionality of the person when we treat him as elderly, or as a normal person, or a middle-aged person?
You see, for the sake of convenience, the various governments of the world have a cutoff point for calling a person as elderly. And for the developing countries, this cutoff point is at the age of 60. And for the developing world, for the developed world, the cutoff point is 65. But by and large, according to the World Health Organization, the cutoff point remains at 60, which is applicable to our country also. But I would hasten to add that this cutoff point is purely a cutoff point for the sake of convenience. It is not equivalent to the biological or physiological age of the patient. And as you gave some examples, these people who are 60 plus, they may be fit even at the age of 70 or even 75. And some other people heterogeneously may actually be biologically weak and sometimes to the extent of being frail. So, age is not a bar. Age is not a real cutoff point for the physiological age. It is a cutoff point only for the chronological age. And as far as obesity is concerned, I think across all ages, once the obesity becomes a more than cosmetic problem, this is what happens to the elderly. They have some other associated problems which are basically age related. They may have multiple other diseases occurring at that age in any other person also at that age, and they also have come to develop certain more a greater magnitude of stress related problem, psychosocial problem, and impairment of various senses, like visual sense, hearing sense, and also about motor coordination. They are not able to do exercise and all that. So I think there are multiple problems associated with obesity in older age, which are not there normally in younger adults with obesity. So I think obesity is no longer a cosmetic phenomenon. It's no longer to be regarded as a stigma. It is really a disease which has to be identified, diagnosed early, and intervention has to start.
So this is very important part, sir, and this is again, eye opener when we look at elderly person with obesity. So how once we start looking at obesity in a person in the higher age group, uh, would the normal cutoffs of BMI will be sufficient, or should we be looking at, measures of central adiposity, or maybe something like body composition analysis, where we are able to see what is the fat percentage in body?
You are absolutely right. I think BMI is a good parameter for general measurement of obesity in younger people. But unfortunately, it is not so suitable for measuring the obesity in elderly people. There are many reasons for that. One of the reason is that, as you know, BMI is related to weight in relation to height, and in the aging individual, there is a somewhat decrease in the height, so BMI becomes fallacious. It overestimates or underestimates the obesity in elderly people. And one of the reasons is that As I said earlier, the elderly people may have fat inside and there may be a continuing loss of muscle with increasing age, and therefore what you see through BMI is not actually what is happening inside the body. So there are multiple parameters that can actually and accurately measure and determine whether the person is actually obese, either internally or outside. So one has to measure the fat content and relative to the muscle content or lean body mass in the body, and there are many investigations for that. And I think one of the easiest investigation to first find out how much loss of muscle is there in an elderly individual who also harbors fat either inside the body or even in the subcutaneous tissue under the skin. So a very simple questionnaire can be administered to every individual who is elderly and who is suspected of obesity. And this simple questionnaire will determine how much muscle he may have lost, how much muscle strength he may have lost, and how much compromised his muscle function may have been. This is simple 5 to 7 minute questionnaire, and you can find out about his strength, about his rising capacity from a chair, or you may ask him how much frequently he has been having falls, and there are some 2 3 more parameters. So that is the first thing. But for a relatively a better idea of how much is the muscle mass or fat mass, there is a relatively cheaper method, what we call is bioelectrical impedance
Impedance,
test, and
bioimpedance, yes.
bio impedance test, and that can be done, but that is not 100% accurate, but that is applicable easily at many places. It is not very expensive also. But if someone can afford and the facilities exist, then DEXA can also be done to measure the amount of fat versus muscle. And of course, there are other tests which are fairly expensive and they are not available at all the places like MRI or CT scan. So these are the various methods to measure obesity and fat content in the elderly individual, or for that matter, for many other individuals afflicted with obesity.
So, that brings me to another question, sir. Once we say that we are seeing a lot of elderly now with obesity, and obesity, when we say, as you very rightly, highlighted that it is a disease, it is not a shape or it is not just, the weight. And once we are looking at a disease caused by sick adipose tissue or sick fat in body, then we need to treat it also. Now, what happens is whenever we look at the management of obesity, the first thing that comes to mind is the lifestyle interventions. And as you rightly mentioned, there is a lot of sarcopenia, loss of muscle mass. So to build up that, person needs to exercise and maybe some strength training also. But once you are talking to somebody who's in the older age group, they will tell commonly that I am already done with my life. This is not, I am not going to do this exercise. This is for young people. So, what is your take on this? Does exercise help elderly, or it is, or we should be afraid that, the person may get injured, or, it is not the right time to advise him exercise with some muscle training?
I think any elderly person, if he poses such questions and doubts about exercise, he has to be properly counseled, advised, and assured. And I think the first thing that exercises are not contraindication for older people, provided they are properly prescribed by a geriatrician or an endocrinologist in consultation with a physical therapist. We will not ask him to do a very brisk walking if he is not able to do it. There are many other exercises which have to be tailored according to the elderly individual and his medical capability. But I would like to say that if he does not do exercise at all and is only depending on diet restriction, his muscle loss will be faster and the whole purpose of losing weight will be defeated in the context of other complications that may arise in the absence of doing exercise. I think the exercises is which are recommended for these people, of course, according to their medical capability, is aerobic exercises that should be about 150 to 300 uh, minutes of walking according to his convenience per week. That comes to about 30 to 40 minutes of walking per day. That is important. There are many other aerobic exercises which I am not going to deal at this time. But coupled with this daily aerobic exercises, it is very important to keep the muscles going and strong, that he should be advised to have some strengthening exercises, strengthening or resistance exercises, which can be carried out about 2 or 3 times a week only, because if he does them daily, he's going to get pain in the body and joints, and he will not be able to pursue these strengthening exercises on a daily basis. So they have to be done only for 2 to 3 days, and there are a variety of strengthening exercises. It could be used on weight, but I would like to say that those who are so not so physically able to do any kind of such exercises, I think there are some other exercises which he can do at home also. And he may not be able to go out because of bad weather, because of his physical limitations. So he may do these exercises at home also with minimal or no equipment also. These consist of, for example, the rising from chair or wall push-up or biceps curl or step and down exercise. These kinds of exercises are always available and they can do it. And I think it is also important to add that those who are still not able to do any exercise even at home, there are some exercises which are water-based exercises. They can be done supervised. They can do exercises in sitting position also. For example, there's a chair yoga available, and even exercises in sitting position are also admissible and they are available. And in certain cases, virtual based exercises or internet based guidance to exercises, they can all be done. But I think it is important that depending on his medical capacity, certain exercises have to be prescribed and uh, keeping in condition of the medical condition, and they have to have some amount of strength exercises on intermittent basis, as I just now said. And the other thing that I would like to say that it is important to know that in our country the roads are not very friendly for the elderly people, and many elderly people have lack of motivation. They feel exhausted even without doing exercises. So they have to be constant, they have to be motivated. That is more important. And like good spaces have to be made available outside near the home. If they are not available, he could do it at home also, as I said just now. Thank you.
I think these are very important points, sir. And when we are looking at people, elderly with obesity, I think even those who are not apparently obese, the first thing we have to make sure is that they are exercising and they are maintaining or keeping their muscle mass intact as far as possible. And another important challenge that we see is that we have largely vegetarian population, so protein intake is usually lower. So supplementation of protein along with exercise becomes important. But now we are seeing people who are visibly obese or who are obese by the usual parameters that we look at for assessment of obesity even in the elderly age group. So in these people, what is your take? Should we be advising them weight loss, and if yes, what all should be the strategies?
You see, if they are harboring internal obesity, they are not having so much of obesity under the skin, they should still be doing exercises. Actually,
Yes.
exercise is a part of healthy aging for any person who wants to remain fit and fine for a longer period of his life. So, exercises have to be advised. But as I said, the exercises have to be tailored according to the uh, patient's own condition from the physiological point of view. But even if he has the internal obesity, he, like any other elderly person, he has to do exercise, and some weight loss may be required provided he doesn't have too much of muscle loss. But if he is having muscle loss, he should not be given any kind of other prescription or any other advice which further encourages the weight loss. That is my take on that. And there are multiple medications that are available and elderly are also taking. They are actually inadvertently are also promoting the weight gain. So they have to be stopped or replaced by other medicines which are not weight promoting. The other point of these people are whether they have internal obesity or external obesity, they have to be advised a proper protein portion in their diet, because as you rightly said that in our country most people are taking high carbohydrates in diet and very little protein. So adequate amount of protein has to be taken by them, and that there are many formulas available. I would not go into the technical details of the how to measure these proteins and all that, but suffice it will be to say that they should be encouraged, particularly those who are socio-economically not very strong. They should be encouraged to take many proteins which are even affordable. And these proteins, I think they should know that these proteins which are to be advised, they should be leucine rich primarily, and they should also, for example, take white egg of the white of the egg, or pulses, legumes, and paneer, cheese, curd, milk, etc. They can always take. And if they are non-vegetarian or vegetarian, they can take fish. And if they are non-vegetarian totally, they can take chicken also. So these are all things. And I think there is another thing called hemp seed. Hemp seed is quite good. It's good in protein. It is good in leucine. And another thing I would advise, and I do advise some people, that when they prepare the curd by acidifying the milk, and when they squeeze uh, this part to get the cheese, the liquid which comes out, it is called whey. Whey is also good. It's full of protein components like amino acids, and these are muscle building amino acids. So they could either mix this whey in the wheat when they are preparing it for the chapati, or they can otherwise drink also, and they can make these drinks. So these are various protein sources that they could have this, and that will prevent the weight loss, even if you are advising them some amount of exercise. And
I
I
think
think
these are,
another
yeah.
important thing, that they should also be advised that not only important what to eat, it is also important when to eat, and it is also important how to eat. You see, when to eat, by that I mean that in the modern civilization, most people are now becoming more active in the night and get up in the late. So the old formula, early to bed, early to rise, is being forgotten. Many people are becoming what I could say that they are no longer morning star, but they prefer to have night's owl. So that kind of thing should also be avoided, and they should take an early dinner. So that is when to eat. And according to the old adage, some people used to say, this might be holding true now, that you breakfast like a king, lunch like a prince, and dinner like a pauper. So this is when to eat. And I think another thing is important. Even elderly people are, many times they are engaged in busy life. So they are also eating very fast. So how to eat is also important. Fast eating is not something good. Fast eating will not help reducing obesity. It will actually promote weight gain. So when to eat, what to eat, and how to eat is also important for all the people, including elderly. Thank you.
Yes, Dr. Kirti, you wanted to ask
Sir,
something.
so this is my question to you. Basically, I am sure you must have been a part of weight loss journey of number of hundreds of patients, and you must have this experience with elderlies also. So, what were your challenges which you faced when you were having them in that journey?
Well, the main challenge that which I see in elderly people for any kind of intervention, they come to acquire a fatalistic attitude. They think that they are done with the life and they just would like to relax and enjoy and do not do any exercise. They do not care about their food. Family, some of the family members are also not worried about their elderly. This is the challenge that I have to say. So I think a strong counseling is very important in elderly for anything, even for obesity or for any other thing, even for living a good life and a healthy life. So this is the greatest thing that I find out. I think we should not be led away by the scene that we see many elderly doing exercise in the parks, and they are also walking briskly and all that. This is only a minuscule. We have 150 million elderly people, and out of 150 million, I'm sorry to say that one third of them are below poverty line, another one third are almost just above the poverty line, and only remaining one third, a little less than one third, are middle class, and hardly 5 to 7% are the elite class. So it is difficult to see how you can manage the entire population of the country with a good intervention from the medical point of view.
Perfect.
I think, sir, these were very important points, because obesity has become a challenge, I think, for the century now. And everybody needs to be taken care in terms of obesity, looking at the kind of complications one can get. Even the number of cancers we are seeing that are increased by obesity, and elderly are especially, age group when the cancer incidence increases. So the most important points I take away from this discussion is one, that in elderly, it is not just the appearance which will give you clue to obesity. I think we need to see and keep in mind that they may be having sarcopenia uh, along with the excess adiposity which may not be visible. And second thing is every elderly should be exercising regularly to maintain good health. And if they are visibly obese, of course, we should treat obesity, but keeping in mind that we do not worsen sarcopenia at any given point of time. And I think most important thing is that we need to do a lot of counseling and a lot of engaging them in discussion to explain them how we are going to do this and why they should be, getting the obesity managed. I think these were the key points which I could pick up. If Dr. Kirti has some more, questions to you, she will ask. Otherwise, we will have your final closing remarks, sir.
No, sir, I am done. Excellent session, I must say. Thanks a lot.
Dr.
So, yeah,
Makkar,
yes, sir.
Dr. Makkar, you have absolutely summarized the whole discussion so beautifully. I am very grateful to you to have given me this opportunity. I would
No,
just
sir, it is an honor for us.
I would just add that as a part of counseling or non-pharmacological intervention, elderly people should be encouraged to interact socially, and also those who are on the verge of getting age-related uh, cognitive decline or forgetfulness, they should continue to be stimulated cognitively either by themselves or by their near and dear ones. There are multiple methods of meeting the stress, winning over the stress, busting the stress by social and cognitive stimulation. That is what I would also suggest, and I think you have summarized so beautifully. I do not have any additional point to offer, but I wholeheartedly agree what you have said. Thank you, Dr.
You said just now you offered one more point, the stress, and stress is one of the factors which again, leads to increase in obesity. So this was a point which I was missing. So I think this is also very important point we should keep in mind.
Well, I have having talked to some elderly people, and also it applies to young people also, but probably it when it applies to elderly people, it is harmful. Those who are stressed. By stressed, I mean they may just be always in a hurry. They may be very busy people even in old age. But this kind of stress, what is happening? They may not be sleeping well. So those who do not sleep well, those who are having day-to-day stress, not a over having chronic stress, but intermittent stress, these people keep doing what is called binge eating. They have
Yes.
emotional eating, they pleasure eating. चलो कुछ करने को नहीं है तो फ्रिज में से कुछ खा लेते हैं. So
Hmm.
that kind of thing is also bad, and I think elderly people have to be counseled for that also. They are doing it very unconsciously. They are not even knowing that they are harming by this emotional eating, because this is all going to attenuate their satiety very badly, which is very unfavorable to the obesity management.
Yes, sir. I think this was another important point which came up with your closing remarks. Sir,
Thank
with this, we come to end of this session, and I must thank you. Actually, I can't thank you enough for, joining for this program and sharing your wisdom with all of us, because this is a very challenging area of obesity. And obesity in elderly, I could not think of anybody better than you to, shed some light on this subject. So thank you very much, sir. Thank you from the bottom of my heart for joining for this program.
My pleasure.
And
Thanks a lot, sir.
thank you everyone for joining this Facebook Live. Those who have missed the live discussion can always, go to our Facebook page and see the recording. Thank you, sir. Thank you.
Thank you, Dr. Makkar, and thank you, Dr. Kirti, for
My
having.
pleasure. Thank you, sir.
Thank you, sir.
Okay.